All right. Hello. Welcome, everybody. Today, we have the wonderful and amazing Malia Rogers, one of my favorite healthcare consultants. And today, we're going to talk about a couple of things that have been huge changes in the healthcare system, specifically around the Inflation Reduction Act and Medicare and Obamacare. But first, Malia, welcome. How are you doing today?
I'm doing great. Thank you for having me, Jason.
Absolutely. It's always great to see you and great to hear from you and get these updates because there's just a lot going on in this world. We're very excited to learn about that. So what we want to start with is what we're calling the family glitch, right? There was a fix in the family glitch. What we want to do is help everybody understand today what this means, how to possibly take advantage of it, and ideally keep some more money in your pocket in these challenging high inflationary times, right? Malia, let's get started off with you describing what is the family glitch and how is it fixed and what are the updates we need to know?
We definitely could use some good news. And a very recent change was the family glitch has been fixed. Now, what the family glitch is previously or currently, if you are offered coverage through an employer, then your dependents would not be eligible for a subsidy on the exchange, even if the cost of adding your dependents is super outrageous on a family plan. For example, if it costs $1,400 for coverage on employer coverage, then you would be better off going on the marketplace and getting that subsidy, but now you're not eligible for it. So with the family glitch fix starting in 2023, if it is unaffordable to get insurance through an employer sponsored plan, you can actually apply and get the subsidy and buy your own plan on the marketplace. And this actually only applies to the dependents, not the employee, because usually it's really cheap to add the employee on the group plan.
Okay, so let me just make sure I fully understand that. Let's say you have a job and you have health insurance that's coming in through that job. And for
Yes.
the employee, the price is good and the price is decent. But if you want to add your children on that, then that is going to potentially be a much larger cost than you might expect.
Yes.
If you were going totally through the healthcare exchange, also known as the Obamacare exchange, the ACA exchange, then if you're doing that on your own, you might qualify for that government subsidy based on your income that can bring down your monthly premium to a level that is generally affordable. But if you had a workplace plan, you couldn't basically double dip, right? You couldn't get the workplace plan at a good price for the employee and then add the children on or dependents on and also get that subsidy. But now you're saying that they fixed that and you're able to get both done. Is that correct?
Employee generally would stay on the employer plan, and then the dependents can go and buy their own on marketplace. And there is
I
a
see.
test to it. So basically it has to be that the cost to add the dependents is more than 9.12% of your total household income.
So it needs to be more than 2022 year inflation, 9% to qualify for this, right?
Yes.
Okay. How does that work? What does a family need to do to actually implement this if they wanted to?
I highly recommend that they get with a broker that can help them walk through their options on marketplace and help them calculate their income, because there's a lot of things to know. Like, what do you count as income? What do you not count? Do you count the gross or do you count the net? It's always a good idea to have an expert walk them through that. And there's never a charge to use a broker, so they might as well get some help.
Yeah. And I think that's something some people might not be aware of is
Mhm.
that whether you go on healthcare.gov yourself and spend the time trying to figure all this out, or you contact a professional, you're not going to pay any difference in price. There's no fees. The government basically pays that fee for you to get some help. So you might as well get involved with professionals, what it sounds like.
That's correct.
Okay, great. And of course, your team at Medigap Pros can help with that.
Yeah. So we are licensed in most states, and we do have other agents that specialize in certain states too that we could refer out if you prefer to meet with an agent locally
Okay,
as
great.
well.
So you have some contacts around the country if that's needed for somebody, if they want to meet somebody locally in the office, for example.
Yes,
Okay,
that's correct.
great. Anything else we need to know about that family glitch that has been now fixed?
The main thing is that they can enroll right now during open enrollment, and we'll talk about that time frame later on, but the changes start January 1st.
How about we talk about it right now? What is the open
Yeah.
enrollment period?
It varies depending on the state. Most states follow the federal open enrollment guidelines. And we're talking about the exchange here, Obamacare marketplace. Most states starts November 1st and it ends January 15th. And if you want the changes to go into effect January 1st, you need to put in your changes by December 15th.
Okay.
Now, there are some states that follow their own rules. For example, Idaho, where I live, we start open enrollment October 15th and it ends December 15th. And then there's some states like California, New Jersey, New York, and DC. Theirs will end January 31st. And then there's a few other states like Massachusetts that ends January 23rd. So it's definitely a good idea to stay on top of it and reach out to a broker for the deadlines.
Great. It sounds like as long as you're getting in contact and starting the process by early December, you should be good, but you may have some flexibility depending if you're in a certain particular state. But ideally, we don't want anybody to wait, right? We want to get them on this so that January 1st, they're ready to go and they start 2023 on the right foot with their health insurance.
Yes. And remember, your deductible starts all over again. So you don't want to say you're on a plan and then you meet your deductible January 10th, then you make changes January or February 1st, it goes into play and then you start your deductible again.
Oh, that's a good point. That is one of the planning tips that I like to recommend for folks at the end of the year is see how much is left on that deductible and try to max that out if you can, if you need any sort of medical type procedures before it starts all over again. So that's really good advice. Appreciate that. Let's shift over to the Inflation Reduction Act and talk about some of the changes there, possibly with the Obamacare type insurance and even Medicare. If there have been any, we'd love to hear about that.
So lots of good changes coming down the pipeline. It is going to be introduced in phases. And so for 2022, this year, they decided to expand the extra subsidies and increase that income limits to qualify for the subsidy another 3 years. We're going to expect to see generally affordable coverage for most families on Marketplace. So that's good.
Oh, that's great. Let me ask you right there. So for another 3 years, that's wonderful, especially for our early retirees that are retiring prior to the age of 65, where they may need to go to the Marketplace. Do you have the current income limits that we're expected to potentially qualify for a subsidy up to?
Yeah, I notice it varies depending on their zip code and their age. I just plug it in to the calculators because I'll give you an example. Before the American Rescue Plan Act, if you were a household of two and you made over $68,000 a year, you wouldn't qualify for a subsidy. But now I have couples in their 60s that are making over $150,000 and they're still qualifying for a large chunk.
Wow.
At the same time, if you have a family of two and they're in their 30s making $150,000, their subsidies are not going to be as high.
So there's an age-based potential for an additional subsidy depending where you're at. That's actually really wonderful because that's something I've been beating the drum on for a while is there's a lot of people that can mostly retire a little bit early before they get to that age of 65 where they qualify for Medicare. But then you add in the cost of healthcare and it could be sometimes over $1,000, maybe even $2,000 or more, depending on the state and amount of coverage people want. This sounds like it's going to be very helpful for that particular group. So again, going back to how do we figure this out is to get in contact with a broker in the health insurance space to do a specific analysis on their situation. It sounds like would be the best thing.
Yes.
Okay, good.
Yes. So 2023, the big changes is that Medicare members, there are going to be certain caps on insulin. So $35. Now it's not all injectable insulin. It's just certain ones. The other big one is the shingles vaccine will no longer have, you're paying out of pocket for that. So that was a huge deal for seniors. Before we would just say, hey, before you get on Medicare, get your shingles vaccine. But now it's not going to cost them anything. So that's a big one.
So can you give me some more detail on that donut hole, how that works, or is that another one of those that depends on the state?
It doesn't depend on the state, it depends on the year and what Medicare sets that every year. But it's a big deal. I often see people paying $3,000 a month for their prescriptions when they're in the donut hole. And so this is huge. 2025, though, another change will happen, and there will be a $2,000 cap on your copays period for prescriptions. So that's going to be really huge.
So the most they'll have to pay out of pocket for everything will be $2,000.
Yes.
And what could it have been before potentially?
There are some drugs, like one prescription, I think it's a cancer medication. It was like $8,000 for a month's supply.
Wow.
Some of these drugs get really expensive. So a really exciting change that's coming down the pipeline too. This is going to save the government money.
Which means it saves us the taxpayer, right? Hopefully.
That's true. Between 2026 and 2029, the government will be allowed to negotiate the prices on prescriptions. So this is really interesting because Part B prescriptions is going to be drugs that are administered in a doctor's office or like a facility. It's really expensive. Some of these drugs are so expensive that there's about 50 of them, 50 of these Part B drugs that make up for 80% of the total spending. That would be in 2019, it was like $30 billion was spent just on these 50 drugs that are covered under Part B. What's going to happen? The U.S. Secretary of Health and Human Services, they're not allowed to interfere with negotiations with the manufacturer, with the pharmacy, or drug plan carrier. So right now, there's no interference. They're changing that so that they are now allowed to negotiate some of the most expensive drug prices. And so in September of 2023, they're going to announce what those drugs are going to be. And then they'll have about a year of negotiating. And then 2026, 10 of those drugs, the maximum fair pricing is going to be established. 2027, another 15 of those drugs will start having that new pricing. 2028, another 15 drugs. And then 2029, the remaining 20. How they're going to enact that or how they're going to enforce that is the manufacturers that don't comply with that, they're going to be taxed. There's an excess tax of 65% of their sales. And then it just keeps going up to 95%, or the manufacturer can choose to withdraw all of their drugs from being offered, or they face penalties.
Wow. So I don't know how I feel about that as a whole.
Yeah,
It's kind of like, do we want the government involved in these things? But at the same time, when I hear $8,000 a month for a medication, for a cancer patient especially, that's quite challenging as well. So I'm just going to hope for the best and hope they do a good job and really help out folks that are in need of these medications, because $30 billion sounds like a lot of money for medications. What else do we need to know about changes coming from the Inflation Reduction Act for either Medicare or Obamacare?
There's just so many changes that I haven't even touched on. I did post the full list of when the changes are going to go into effect and what I posted in your retirement group.
Retirement Coach Facebook group. So if you are watching this and you have not joined, it's called the Your Retirement Coach Facebook group. Go ahead and join that and you'll be able to get this information in there on how this is all going to work out. What I think we should do, Malia, is I would like to continue this conversation over time, because it seems like there's just a lot that folks need to know about the healthcare space, especially for folks that are making a transition, maybe from work to early retirement prior to Medicare qualification age, and even from work if they're going right into Medicare. There's some things they need to know. So if there's any last tips or advice you'd want to give to anybody that's going through a potential change in healthcare and having to make some changes during open enrollment here, what would that be?
Don't try to do it on your own. There are going to be some costly mistakes if you try to do it on your own. And of course, it never costs anything to use a broker.
Excellent. Malia, I want to thank you so much for coming on today. It's always great to see you and have a chat with you. And I look forward to continuing our conversation on the next time.
Thank you, Jason. Have a great day.
All right, folks. Thank you. We'll see you next time.